Is your penis size normal? Have you ever wondered if your size is enough? Have you ever compared yourself to what you see online, in movies, or in pornography? Do you feel uncertainty or even insecurity about whether your body is within what is considered normal? Do you think size is the most important factor in sexual performance? And most importantly, do you want to understand what actually matters from a medical and scientific perspective? If you have ever asked yourself any of these questions, you are not alone. In fact, this is one of the most common concerns among men worldwide, and at the same time, it is one of the most misunderstood topics in male sexual health. I'm Dr. César Noval Font, plastic surgeon and medical director of Clínica NEF with clinics in Spain, Miami, and Mexico. We specialize in penile enlargement procedures, including lengthening and girth enhancement, as well as gender affirmation surgery. On our Spanish YouTube channel, we have helped millions of people better understand their bodies through clear, honest, and medically accurate information. This English channel has been created with the same purpose: to help you understand your body, improve your sexual health, and make informed decisions without myths, without pressure, and without misinformation. Now, to answer the question of whether your penis size is normal, we need to begin by removing one of the biggest problems in this topic. Most men are not comparing themselves to reality, they are comparing themselves to distortion. What you see in pornography, in certain media, or even in exaggerated conversations does not represent the average male body. It represents extremes. From a medical perspective, we have very clear data about what is considered a normal penis size. Multiple large-scale studies have measured this objectively, and the results are consistent. The average erect penis length is approximately between 12 and 15 centimeters. The average girth is approximately between 10 and 12 centimeters. This means that the vast majority of men fall within this range. However, perception is very different from reality. Many men believe that average means small, and that anything below what they imagine is inadequate. This perception is one of the main sources of insecurity. Now, let's understand something very important. Size, from a biological perspective, is not the primary determinant of sexual satisfaction. Sexual response is a complex interaction involving the nervous system, emotional connection, arousal, and communication. The idea that size alone determines performance is a simplification that does not reflect how the body actually works. From an anatomical point of view, most of the sensitivity in the vaginal canal is concentrated in the first few centimeters. This means that extreme size is not necessary to produce stimulation. In fact, in some cases, excessive size can even create discomfort. So, why does size feel so important? The answer is psychological. Size has been culturally associated with masculinity, confidence, and performance. This creates a strong mental link between size and identity. And once that link is established, it becomes difficult to separate perception from reality. Now, let's go deeper into how this affects the brain. When a man feels insecure about his size, his attention shifts. Instead of focusing on sensation and connection, he focuses on evaluation. Am I enough? Is my partner satisfied? Am I being judged? This shift activates the same areas of the brain involved in anxiety and self monitoring. And as we have discussed in previous videos, this directly interferes with sexual performance because sexual function depends on relaxation, not evaluation. This means that insecurity about size can actually affect performance more than size itself. Now, another important factor is comparison. Men tend to compare themselves with what they see, but what they see is not representative. It is selected, exaggerated, and often unrealistic. This creates a distorted baseline, and when your baseline is distorted, your self perception becomes inaccurate. In clinical practice, we see many men who are objectively within a normal range but who perceive themselves as inadequate. And this perception alone is enough to create anxiety, reduced confidence, and even erectile difficulties. Now, let's address a question that many men have but rarely ask openly. Is there such a thing as a size that is too small? From a medical perspective, there is a condition called micropenis, which is defined as a size significantly below the normal range. However, this is extremely rare. The vast majority of men who are concerned about their size do not fall into this category. They are within normal variation, and variation is natural. Just like height, weight, or any other physical characteristic, there is a range. Not everyone is the same, and not everyone needs to be the same. Now, let's talk about function, because this is where the real focus should be. Sexual satisfaction depends on multiple factors: erection quality, control, arousal, communication, confidence. All of these play a role. If these factors are functioning well, size becomes secondary. But if confidence is low, even a perfectly normal size can feel insufficient. Now, there is another important aspect to consider: body image. How you perceive your body affects how you experience it. If you perceive your body negatively, you create tension, you become self conscious, you disconnect from the experience, and this reduces your ability to respond naturally. This is why improving perception is just as important as understanding anatomy. Now, let's address the question of whether size can be increased. There are many claims, many products, and many promises. But from a medical perspective, most non surgical methods do not produce significant or permanent changes. This is important to understand to avoid unrealistic expectations. There are surgical options, and as specialists, we perform these procedures, but they are not for everyone. They require proper evaluation, realistic expectations, and a clear understanding of benefits and limitations. The decision to undergo any procedure should always be based on informed medical advice, not on pressure or insecurity. Now, let me tell you something that is very important. Confidence does not come from size. Confidence comes from understanding. When you understand your body, when you understand what is normal, and when you understand what actually matters, you reduce unnecessary pressure. And when pressure decreases, performance improves. This is a consistent pattern. Now, let's go back to the original question: is your size normal? Statistically, in the vast majority of cases, the answer is yes. But the more important question is not whether your size is normal. The more important question is whether your perception is accurate, because perception determines experience, and experience determines confidence. If you correct perception, you improve experience. And if you improve experience, everything else follows. Now, let's take this one step further. Instead of focusing on size, focus on function, focus on erection quality, focus on control, focus on connection, focus on understanding your own body. These are the factors that truly define sexual health, and these are the factors that can be improved. Because unlike size, which is largely fixed, function is dynamic. It can change, it can improve, and it can be optimized. This is where real progress happens. Now, let me close with one key idea. Your body is not a problem to be judged, it is a system to be understood. The moment you shift from judgment to understanding, everything changes. And that is the purpose of this channel. If you found this explanation useful, subscribe to the channel. Here, we approach male sexual health from a medical and professional perspective, helping you understand your body and improve your quality of life without myths, without misinformation, and without unnecessary pressure.